Hi! Hello, this is Dr. Vijay Kumar Chennamchetty, Senior Pulmonologist. So, what are the various symptoms of sleep apnea? So, sleep apnea means those patients who snore. These kind of patients, generally almost 50% of them, they may be habitual snorers. That means their snoring need not be evaluated. But in rest of the 50%, they may have a severe problem which can lead to various medical issues like cardiac issues, renal issues, and so on and so forth. So that's why if you are a snorer, the key things that you must observe is when you are sleeping, when you are waking up with dryness in throat. That means you wake up in the middle of the night or early morning to drink a lot of water because of dryness in the throat. There's a one important symptom that you may be suffering from severe sleep apnea. Second, you please request your spouse to observe for witnessed apneic spells. What is witnessed apneic spells? I'll demonstrate it for you. See, observe this. During sleep, you snore and suddenly waking up with a jerk. If this is happening, again, my dear friend, remember you must be suffering from severe sleep apnea. So, a severe sleep apnea should be addressed immediately to keep you hale and healthy. Next important symptom is excessive daytime sleepiness. What is excessive daytime sleepiness? When you are being given some task to do and you fail to complete the task with full energy and full concentration, and meanwhile during a task you tend to doze off. That means you're asked to read a book and then while reading book you tend to doze off, you tend to sleep off. So without your knowledge you will be sleeping off. You are waiting, lot of patients comes to my chamber and then while they were waiting at my outpatient department at the reception, they tend to doze off. So I can pick by observing them. So when I come for from rounds to outpatient department, I'll just give a look. So if someone is sleeping, someone is sleeping, definitely I can think that this is the patient probably suffering from sleep apnea. So my dear friends, if you have this excessive daytime sleepiness, you are probably suffering from severe degree of sleep apnea. Other most important thing is mood changes. Mood changes can be expressing anger, frustration, and your short-temperedness for even small issues. You also realize with introspection that these would have been sorted out without anger, without expressing the frustration. But you generally tend to end up creating, for even small issues, you create a lot of unnecessary arguments. You will end up in arguments and fighting with others. So if you are having these kind of symptoms, this is very high time to correct your sleep apnea. And generally for sleep apnea correction and identification, apart from symptoms, you need to do a test called home sleep apnea testing or hospital sleep apnea testing called sleep study, and then followed by, based on the severity, your pulmonologist will advise what is the best treatment available. So this all you need to know about symptoms of sleep apnea. Thank you.